Tuenda kulaunchingaho mental health run in Mbarara city.
So much. I am called Barbara Mtaire, the founder and team leader at UKARA Mental Health Services, and today we are here launching this vest because we have a mental health awareness run in Mbarara city. Why are we having this? It's because we've noticed we've been doing awarenesses, we've created awareness, but we haven't been doing action. So our theme, this month's theme is turning awareness into action. Because the moment you create awareness and you don't go on ground to do what it is supposed to be done, trust me, it's like you will have done nothing. So as UKARA Mental Health Services, in partnership with different organizations, we've come together. Since May is usually a mental health awareness month, we've decided to have this awareness run in Mbarara city so that people in Mbarara, in Western region, can participate, and we really put awareness, we turn this awareness into action. It's going to take place in Mbarara city at Rotary House, which is commonly known as Children's Peace Park, opposite Lakeview Hotel in Mbarara city. We go to school, so we don't have to there, but when we get, we refer them to these physical rehabilitation centers. But testimonies are there in case you need some.
I'm a counselor at Intare School and the regional coordinator of all counselors in Uganda. I own a counseling home called Your World Counseling Home. Now, mental health. We have a run with UKARA. It will be on 31st of May because May is a mental health month where everyone is encouraged to wear a green ribbon. And UKARA has done it for us for Mbarara district. So mental health by definition, it is a state of physical, mental and social well-being. And mental ill health is a state of the mind where someone is having mental disorders. The statistical data, 450 million people suffer from mental disorders in Africa, and the source is World Health Organization. Nearly 1 million people commit suicide every year, and 1 out of 4 families has at least one member having mental disorders. Uganda is ranked at 6% with the highest cases of mental disorders in Africa, and the leading cause being alcohol and marijuana. 33rd in a global ranking, 4.6 suffer from depressive disorders, 2.6 suffer from anxiety disorders, 700 patients are admitted at UKARA, and these patients, they are usually seen by either 2 or 3 doctors, leaving other clients loitering and sleeping on the ground minus seeing a doctor. And they say 10% only see the formal health care. What are these disorders all about? The disorders, we have depression, we have schizophrenia, we have bipolar, we have stress, we have post-traumatic stress disorders, anxiety, and cognitive disorders. What could be the possible causes of mental ill health challenges here in Mbarara in particular, because it's where we are having a run, Number one, they are saying because of poverty, people are getting mentally ill. They have so many debts and loans from different circles and banks. Then death of a loved one, when someone loses a loved one, usually they don't get back to their feet, hence breaking down. Then we have people getting mentally ill because of relationship breakups. There are people that cannot pick up themselves after a relationship breakup. Then the physical illnesses, especially people who are suffering from HIV, these other chronic diseases like diabetes and etc. Then we also have civil wars. People who are coming from countries where there are wars, usually they run into mental health challenges. What are the barriers? The barriers, number one, in African culture, they think mental health is it is witchcraft. They think maybe you're not blessed, you're seen as a disregard in the society, and these barriers have caused people, for example, not to access health care in the hospitals. And even another barrier, even when you go to the hospitals, there are no drugs. There are no drugs for these people. The doctors are not there, and the numbers are also many. Another barrier, some families think that they are stigmatized to have someone running mad, so they choose to keep them inside. They tie them inside. Some are handcuffed, or others are put in rehabilitation centers. Yeah, majorly that's it. Number one, counseling. Everyone has to embrace counseling. We must look for the services. Counselors, they are available, and we should look for professional counselors who are trained, social workers, and clinical psychologists. Then also we need to keep on sensitizing, like what UKARA is doing right now. We must tell the public and remind them that people are sick, because people don't know. Even when they are sick, they don't know. It is a silent disease that is eating up so many people. So we must remind people that as our health is important, also mental health is also as important as physical health. So sensitization is very, very important. Then also, among the so many causes that are bringing people down and people, breaking down, the family structure is attacked. The parents should come up to discuss these issues openly. If there are issues of drugs, the approach should be friendly. And I think when the parents do their role, the cases also are going to go down. Then also, the government has to come up and support these programs. We need a lot of support to do these things. Most of these programs are self-sponsored, like what this lady is doing of UKARA. She's just sponsoring herself, calling people, moving up and about. So the government has to at least support these programs so that we do preventive other than treatment. Then also, lastly, everyone should take it up upon the responsibility, whether you're a counselor or what, to give a shoulder to whoever that wants it, because people want to be listened to. They need to be listened to. So if you can be in church and maybe, apart from reading the Bible, if you can send a message concerning mental health, it would be a good deal. So we need to take it upon ourselves, starting from with our friends, the businesses we do, the families where we come from, so that, there's information everywhere.
So with Uganda Red Cross Society Mbarara branch as a first aider. We have seen very many accidents in our country, Uganda, where, including Mbarara, whereby we believe that most of the accidents are brought by people who are driving, having mental health issues. As Uganda Red Cross, you've seen very many ambulances along the way, picking the people here and here. So the reason is why we are partnering with UKARA Mental Health Services and other mental health organizations. It's because we want this awareness to go to different people so that they can be sharp when they are driving. Because we know when people are well, when they have mentally well, they can drive better on our roads. Thank you very much.
As one of my colleagues has said, but you might find that we are not okay. All of us, we are clients. In which way? At times you are moving, you are walking, and you see someone counting fingers. That is one of the signs that this person needs help. The mental is not, the mind and the thinking is not okay. Sometimes my friend has been talking about the drivers. You see, why are they causing accidents? So you find, I don't know. I don't know where my mind was. So it means that is a sign that he was not okay. By that time, he caused an accident. When you go to schools, as I've told you that I'm a teacher, and you see how children are collaborating, are working together, you feel like maybe we need a doctor there. Because you see, their behavior, their actions, how they are maybe praying with one another, you feel like they need help, because some of them are apparatus, they are destructive, they don't have that kindness that we normally talk about, they don't consider their fellow children as human beings. So it means we need this in our country, not in our region alone, but in our country. When I go to our families, and you see most especially couples, when I pay visit there and I try to see, to observe how the couple is sharing, is talking, one can understand that maybe a man or a woman is mentally ill. So there are so many signs when you go to churches or worshiping areas, and you see maybe how the pastors, the imams, the reverends, so-called leaders, one of them has said that they are counselors. We talked about them, but they also need our services, the way they are doing their things. So our signs and symptoms, they are there within us, they are in our communities. We need this, you need it, I need it, and you find that you're a client, I'm a client. That's why we are partnering with UKARA, so that our community is aware. We no longer want to talk without acting. Whatever we think of, we need to implement it. That's why we are here. Thank you very much.